Are you silently battling poor circulation, numbness, or weak erections, and wondering if it's just part of aging? If you have diabetes, these symptoms aren't just frustrating. They're warning signs that something deeper is happening inside your body. Blocked veins, damaged nerves, and low blood flow can quietly destroy your health and your intimacy. But here's the good news. 3 powerful vitamins, backed by science, may hold the key to reversing the damage, restoring blood flow, and even reigniting your confidence in the bedroom. Forget gimmicks. This isn't about quick fixes or empty promises. It's about giving your body what it actually needs to heal from the inside out. Let's break down exactly how these natural tools can help unclog your veins, improve your erections, and support your long-term vitality. Keep watching. The solution might already be in your supplement drawer. 1. Methylcobalamin or vitamin B12. Methylcobalamin is a neurologically active form of vitamin B12 that plays a crucial role in nerve regeneration and blood vessel dilation, 2 areas severely impacted by diabetes. When blood sugar remains high over time, it damages the small nerves that control vascular relaxation. In the penis, this leads to narrowed blood vessels and poor blood flow, making it difficult to achieve or maintain an erection. Methylcobalamin helps rebuild the myelin sheath around these damaged nerves, enhancing signal transmission and restoring vascular muscle control, but its impact goes deeper. Methylcobalamin significantly lowers homocysteine, a toxic amino acid that contributes to arterial stiffness and plaque formation. Elevated homocysteine damages the endothelial lining of arteries, leading to microvascular injury and poor nitric oxide production. Without nitric oxide, blood vessels can't relax and blood flow becomes severely restricted. By reducing homocysteine, methylcobalamin protects blood vessels and reverses early atherosclerosis, which is a common cause of clogged penile veins in diabetics. It also boosts oxygen delivery by supporting red blood cell formation. Oxygen-poor tissue is slower to heal and more prone to fibrosis, another contributor to sexual dysfunction. Methylcobalamin improves cellular metabolism and mitochondrial energy in the endothelial cells, which accelerates tissue repair and reduces inflammation. Even more impressive is how methylcobalamin helps manage insulin sensitivity. By improving energy metabolism at the cellular level, it reduces stress and inflammation, making the body more responsive to insulin. Better insulin function means lower blood sugar levels, which in turn prevents further vascular damage. It also supports dopamine production, enhancing libido and mood. Several studies have linked consistent B12 supplementation with improved sperm quality and motility, especially in diabetic men facing fertility challenges. For therapeutic effects, diabetics, especially those taking metformin, which depletes B12, are advised to take 1,000 to 5,000 micrograms daily of methylcobalamin for at least 3 to 6 months. It is available as sublingual tablets or injections for better absorption. 2. Vitamin D. Vitamin D isn't just for bones. It actually plays a pivotal role in insulin regulation, nerve signaling, and maintaining blood vessel tone. Deficiency in vitamin D is unfortunately widespread among diabetics and contributes to worsening vascular health and erectile dysfunction. When vitamin D levels are low, insulin signaling becomes inefficient, causing glucose to linger in the bloodstream. High blood sugar, in turn, damages the tiny blood vessels in the penis, leading to restricted blood flow and, poor erection quality. Vitamin D helps restore insulin sensitivity, improving blood sugar management and reducing the stress on blood vessels. It also assists the smooth muscles in veins to relax by modulating calcium channels, which reduces vascular tension and promotes better blood flow. The benefits don't stop there. Vitamin D also influences cholesterol metabolism, helping the liver produce bile acids that remove excess cholesterol. This prevents the buildup of plaques in penile arteries and veins, a major contributor to vascular blockages and erectile issues. Kidney health is another crucial area where vitamin D shines. Poor kidney function in diabetics results in higher creatinine levels, which indicates waste buildup in the blood. This elevates blood pressure and damages those small vessels. By regulating the parathyroid hormone, vitamin D helps maintain fluid balance and supports kidney filtration, easing the strain on veins and arteries. Additionally, vitamin D activates anti-inflammatory pathways and boosts glutathione, a really important antioxidant. These actions slow down tissue aging and reduce fibrosis and calcification in blood vessels, keeping them flexible and functional. On the hormonal side, Vitamin D supports the hypothalamic pituitary gonadal axis, which governs testosterone production. Low testosterone can severely affect libido and fertility. Vitamin D helps normalize hormone levels while supporting acetylcholine synthesis, which improves nerve control of blood vessels. Natural sources of vitamin D include sunlight, cod liver oil, mushrooms, and fortified foods, but many diabetics require supplementation due to low sun exposure or impaired absorption. The recommended dose for therapeutic use ranges from 2,000 to 5,000 IU per day. 3. Vitamin E, gamma-tocopherol. Vitamin E, especially in its gamma-tocopherol form, is one of the most potent antioxidants available. It protects blood vessels from oxidative stress, which is a major cause of arterial damage and erectile dysfunction in diabetics. High blood sugar leads to excessive free radical production, which really accelerates the aging of blood vessels. Vitamin E neutralizes these radicals and slows down plaque formation in arteries and veins, reducing vascular stiffness and improving the flow of blood to sensitive tissues. It also increases nitric oxide production in endothelial cells, helping arteries and veins dilate properly during sexual arousal. This ensures stronger, longer-lasting erections and prevents premature loss of rigidity. In addition to its vascular benefits, vitamin E improves red blood cell stability, ensuring efficient oxygen delivery to penile tissues. This helps reduce tissue stress and slows down fibrosis and inflammation. Another major function is cholesterol regulation. Vitamin E prevents oxidation of LDL cholesterol, which is a key step in plaque formation. It also reduces inflammation and enhances the flexibility of blood vessels. Hormonal health also benefits from vitamin E, as it protects the Leydig cells in the testes responsible for testosterone production, safeguarding against fertility issues and low libido. Natural sources include almonds, sunflower seeds, spinach, and plant oils. For diabetics, supplementation with mixed tocopherols, alpha, gamma, and delta, is ideal to cover a broader spectrum of antioxidant activity. A daily dose of 200 to 400 IU for 3 to 6 months can significantly improve vascular and reproductive function. Bonus: dark chocolate and epigenetics. Beyond vitamins, dark chocolate, with at least 70% cocoa, contains flavonols that help stimulate nitric oxide production, promoting better blood flow. It should be low in sugar to avoid worsening blood glucose control. Lastly, we need to touch on epigenetics, how lifestyle and nutrition can affect gene expression. Poor lifestyle choices can turn off genes responsible for vascular repair, making it much harder to recover. Vitamins and antioxidants provide key cofactors that support these repair processes, helping reverse genetic damage and restore healthy circulation. Circulation and intimacy issues in diabetics are not just about aging or temporary stress. They are signs of deeper metabolic and vascular dysfunction. By supplementing with the right vitamins, methylcobalamin, vitamin D, and vitamin E, diabetics can begin to repair blood vessels, restore nerve function, and reclaim sexual health. The key is consistency and patience. These vitamins take time, 3 to 6 months or longer, to show results, but when paired with proper blood sugar control and healthy lifestyle choices, they offer a powerful and natural path to healing.